Okay, so again, for today, we will be discussing epidemiology and public health. And as an introduction, let's define first what we mean by epidemiology. Epidemiology is the study of disease and its pattern. Okay, so when you say "and its pattern," we are referring to the factors that determine the frequency, distribution, and determinants of diseases. So the one who studying these factors are called epidemiologists. And they really play a very important role in the public health, especially now that we are experiencing pandemic, because somehow they are trying to develop ways to prevent, let's say, for example, COVID-19. And then they're also trying to control it. So one of the promising ways of controlling COVID-19 is through immunization, so that prayerfully or hopefully in the future we'll be able to eradicate COVID-19, not just here in our country, but in the entire world as well. So these are the different terms that many epidemiologists are using. So the first one is called communicable disease. So it is an infectious disease that can be transmitted from one person to another. So any infectious disease that can be transmitted from one person to another is called communicable. Okay, so let's say, for example, um, tuberculosis is an example of communicable disease because it is an infectious disease that can be transferred from one person to another. However, if a certain infectious disease is not transferable from one person, is not cannot be transmitted from one person to another, even if it's infectious, then we will be calling it non-communicable. For example, tetanus. You cannot transmit tetanus from person to person. So tetanus is caused by a bacterium called Clostridium tetani. Okay, so Clostridium tetani. And it is not transmitted from one person to another. Though it is infectious, but it is non-communicable. Okay, so contagious is another form of communicable disease. Okay, it is a communicable disease that is easily transmitted from person to person. So TB can be considered as contagious. Common colds can be considered as contagious. COVID-19 can be considered as contagious. Now, if you acquire these infectious diseases animals, from animal sources, then we will be calling it zoonotic disease. See, for example, are you familiar with Taenia saginata? Taenia saginata is an example of beef tapeworm. You get it by ingesting insufficiently cooked beef. So that is an example of zoonotic disease. The incidence of a particular disease, the incidence, okay, incidence is defined as a particular disease, okay? So it is defined as the number of new cases of that disease in a defined population during a specific time period. Incidence, new cases, or new number, okay? So, which is different from prevalence. Kasi when you say prevalence, you are actually referring to old plus new cases of a certain disease in a defined population during a specific time period. Remember, previously, at the height of the pandemic, DOH is releasing new cases of COVID-19 on a daily basis. Now kasi they're just releasing it on a weekly basis. But before, at the height of the pandemic, they were releasing it on a daily basis. So each day, we have new incidents of COVID-19. But if we're going to talk about prevalence, we'll be summing up both the old and new cases. Okay, so that is defined as the prevalence. Now, when we say morbidity rate morbidity rate is defined as the number of new cases of a particular disease that occurred during a specified time period per a specifically defined population. So usually, we express it for every 1,000, 10,000, or 100,000 population. Okay. So what is the morbidity rate? For example, in a certain barangay, um, a, a population, let's say, of 50,000, what is the morbidity rate of cholera? So, for example, there were about 3,000 cases of cholera. So, to compute for the morbidity rate, so we divide 3,000 over 50,000, and then we can multiply it by 1,000. So the answer here would be the morbidity rate of cholera for every 1,000 population. If you will be multiplying it by 10,000, so your answer here would be would be for every 10,000 population. If you're multiplying it by 1,000, 100,000, so your answer here would be for every 100,000 population. So that's how we compute for the morbidity rate. Okay? So prevalence, I've discussed that a while ago. So there are actually two types of prevalence. Okay. So the first one is called the period prevalence, and the other one is the point prevalence. So when you say period prevalence, it is the number of cases of disease existing in a given population during a specified time period. So let's say, for example, what was the cases of dengue in 2010? So the prevalence of dengue in 2010. So this now only refer to the old cases of dengue hemorrhagic fever in year 2010. But when you say point prevalence, it is the number of cases of a disease existing in a given population at a particular moment in time. Meaning to say, right now. So what is the point prevalence of COVID-19? So you add the old cases since March 2020 plus new cases today, that would be the point prevalence. But historically speaking, if we're talking about historical facts during 2010, then that's gonna be a period prevalence. Okay, so I hope that's clear. Then the mortality rate is the ratio of the number of people who died of a particular disease during a specified period during a specified time period per a specified population. That is the mortality rate. So usually, DOH would be computing for the number of people who died from COVID-19 over the number of people who got infected by COVID-19, and then you multiply it by 1,000, 10,000, or for every 100,000 population. Okay, so that is the mortality rate. Okay, so all of these you can actually find in the DOH website, or even if you'll be or even in the Facebook page of DOH, if you'll be following them, they're actually releasing the result right now on a weekly basis. Okay. So another epidemiological terms that we are using are the following. No, first we have sporadic disease. Sporadic disease is one that occurs only occasionally within the population of a particular geographic area, which means it doesn't occur constantly. You don't see these cases every day. So for example, tetanus, you don't see tetanus on a daily basis. So tetanus is considered as a sporadic. Okay. Now, when you say endemic disease, is one that is always present within the population of a particular geographic area. Meaning to say, the disease is constantly present in the population of a certain area. Okay, so that's what we meant by um, endemic. Okay, so let me give you an example. So when you say malaria, malaria is endemic in Agusan del Sur. Meaning to say, all throughout the year, there are always cases of malaria in Agusan del Sur, all throughout the year. So which means malaria is constantly present among the population of a certain area. In this case, I'm referring to Agusan del Sur. But you really have to be careful in choosing the term endemic. If the disease is not constantly present, then do not call it endemic. Now, how about epidemic? When you say epidemic, it is a disease, okay, defined as greater than usual number of cases in a particular region, usually within a short period of time. So, for example, there were cryptosporidiosis epidemic during 1993. So it's an epidemic. So, so meaning to say, an epidemic is a disease that easily spreads within the population. In 2019, the local government of Dasmariñas declared a state of calamity. And the reason for that state of calamity is because dengue hemorrhagic fever is of high cases, exceeding the endemic case. And it easily spreads, and many of the hospitals became congested with dengue hemorrhagic fever patients in Dasmariñas in 2019. So that case is considered as an epidemic because the disease easily spreads within the population. Okay. Now, pandemic is a disease that is occurring in epidemic proportion in many countries simultaneously. Okay? Or in fact, the World Health Organization define it if the disease is present in more than 3 geographic continents of WHO region, then it is already considered as a pandemic. Before COVID-19, there were Spanish flu in 1918, which killed more than 20 million people worldwide. Okay? H1N1 in 2010. Okay? 2009 to 2010. HIV and AIDS are considered as pandemic. Tuberculosis, malaria. Right now, we have COVID-19, which started from December 2019 and unfortunately up to the present time. Okay, so this is one of the longest pandemic in the history, okay, in the history of mankind from December 2019 until now. But it was only declared pandemic sometime between in March 2020. But it started in December 2019, but along in March 2020, WHO has finally declared it as a pandemic. And, during the first 2 months, we were we were shocked. We were in initial lockdown. Diba? If you remember, we were in enhanced community quarantine. Many people lost jobs. Diba? People were very anxious. Okay, so that's the pandemic, and I myself was a victim. My mom even died of COVID-19. So, diba? So, it is something that we human beings will never forget at the rest of our lives because it has significantly changed our lifestyle. It has significantly changed our situation and even our education. The pandemic has changed it. Instead of us facing each other right now, I'm just seeing your profile pictures in the Google Meet. I'm actually talking literally to a computer monitor. So that's the COVID-19 pandemic, which we have experienced in our generation. Interactions between pathogens, hosts, and the environment. Okay, whether an infectious disease occurs depends on several factors. Number one is the entry pertaining to the pathogen. So when you say pertaining to the pathogen, okay, what are the virulence factors of the pathogen? So let's say for example, pag sinabi nating virulence factors in bacteria, the virulence factors could be the presence of spores, flagella, metachromatic granules, capsule, and the mode of entry. How do you think the pathogens would enter our body? So I'll give an example. COVID-19 enters through our mucous membrane and the number of microorganisms. Okay, so the burden of having these particular microorganisms. And then another factor pertains to the host, to us. What is our health status? Are we immunocompromised? What is our nutritional status? Are we undernourished? Okay, what is your hygiene practices? How old are you? Where have you been traveling? What is your lifestyle? Have you been smoking? Have you been drinking alcohol? All of these factors pertain to the host. Okay, and the last one pertains to the environment, the physical factors such as the climate, because there are some infectious disease that usually occurs during winter. There are some infectious disease that usually occurs during rainy season. So like say, for example, the dengue hemorrhagic fever. Okay, the season, geographic location, availability of appropriate reservoirs, sanity and housing condition, and the availability of potable water. So these are all factors pertaining to the environment. Okay, so let's talk about the chain of infection. There are 6 components in the infectious disease process. Okay, so the first factor is the pathogen. So pathogen pertains to a disease causing microbes. And then the source of the pathogen. The source of a pathogen would be the reservoir. And then the portal of exit. Okay, so when you say portal of exit, how do you think the pathogens will get out of our body? Okay, so for example, in cases of COVID-19, gets out of the body every time we talk, every time we sneeze. Okay, the mode of transmission. So again, let me give you a COVID-19 as our example. Respiratory droplets would be the mode of transmission of COVID-19. And then the portal of entry. Infectious disease will enter our body. So again, in cases of COVID-19, it enters via our mucous membrane, okay, by our mouth, eyes, and even by our nasal cavity. And then, of course, the presence of susceptible hosts. So in cases of COVID-19, humans are considered to be as the susceptible hosts. Okay, so all of these are considered as the chain of infection. Imagine Bob here is the susceptible host, while Andy is the reservoir. Meaning to say, Andy is infected, and Andy shook hands with Bob, and because but before he shook his hand, Andy actually, Andy actually sneezes using his mouth. He's using his hands to cover his mouth when he sneezed, but Bob didn't know about it. And then he shook hand with Bob. So the pathogens, the viruses are now in within Bob's hand. And after he shook hands with Andy, Bob actually scratches his eyes. Now, this is now the portal of entry. So Bob became infected with COVID-19. So we need at some point to break the chain. We cannot kill the reservoir, of course, but we need to stop. Okay, at certain point, we need we need to break the chain so that the course of infection will not push through. So let's talk about the reservoirs. The sources of microbes that causes infectious diseases are many and varied. So they are known as the reservoirs of infection or simply the reservoir. And there are actually several kinds of reservoir. So it could be a living reservoir. Humans are considered as living reservoir. Pets, farm animals, insects, and even arachnids such as ticks and mites. Okay, so these are considered as the living reservoirs. Okay, now when it comes to human carriers, there are different kinds of carriers, human carriers. No, uh, sorry for that. Let me go back. Okay, passive carriers are when you say passive carriers, they actually pass the infection unconsciously, unknowingly, because at some point they are said to be asymptomatic. I'm just Andy, I just sneezed. So in order for me, or Bob pala, in order for me not to have a continuous chain of infection, I will be breaking the chain by applying alcohol. At any rate, when you say passive carriers, um, they didn't know that they are infected because most of them are asymptomatic. They are asymptomatic. They do not show any signs and symptoms, and yet they are potentially infectious. Okay. When you say incubatory carriers, these are humans. They do not show any signs and symptoms, but they are already infected. But the reason why they do not show any signs and symptoms because the organisms inside their body is still in incubation period. So when you say incubation period, we are referring to the time of inter interval between the entry of microbes and the appearance of the first signs and symptoms. Meaning to say, the organisms are already inside the host, but no signs and symptoms yet. Now, how about convalescent carriers? Convalescent means that convalescence is the period of recovery. Meaning to say, these carriers are recovering, recovering from the infections, but even if they're just already recovering, they're still shedding a residual amount of pathogens that could still be potentially infectious. Okay, so we call them convalescent. So they are recovering, but they're still shedding a potential amount or even a residual potential amount of pathogens. Now, active carriers are the ones that really show signs and symptoms. Okay, so we consider them as the active carriers. Okay, so these are the different kinds of human carriers. In this case, the reservoir of infection. So, for example, the dog poops, and then you get some products from the river. So, sometimes this animal poops may contain the larva of a certain parasite, and then you'll be getting fish, for example, and then you'll be eating fish insufficiently cooked. So, these are the possible sources of infection. Animals. Let's talk about animals. Infectious diseases that humans acquire from animal sources, we call it zoonotic diseases, or in one word, we call it zoonoses. So zoonoses may be acquired by direct contact with an animal, inhalation or ingestion of pathogen, or sometimes injection of the pathogen by an arthropod. Let's say, for example, you were bitten by ticks, and ticks carries the bacteria that causes Lyme disease. Or you were bitten by an animal who that is already rabid, so you can get rabies. Okay, so any infectious disease that you acquire from animal sources, we call it zoonosis or zoonotic disease. So monkeypox is an example of zoonosis. So many different types of arthropods serves as the reservoirs of infection, such as insects, fleas, you can get typhus fever, mosquitoes, you can get malaria and dengue, lice, you can also get typhus fever, arachnids can get typhus fever, different kinds of typhus fever. Okay, when arthropods are involved in the transmission of infectious disease, we call them vectors. Okay, so we call them vectors. And there are two types of vectors. Vectors could be biological, and the other one is mechanical. If you were bitten by an arthropod, then we call it biological vector. Say, for example, you were bitten by a mosquito that carries malaria. That is a biological vector. Now, flies are considered as mechanical vector. So when flies, for example, landed on a stool or in a fecal sample, and the feet of these flies will now be carrying various bacteria, various microorganisms, and then it landed on your food, and then you ate that food that contains these microbes, then you'll get infected through flies, and that means you get a mechanical vector-based infection. So this is an example of a biological vector. Biological vector, because you were bitten by an infected tick. And the only way you get a Lyme disease is through the bite of an animal. So by the bite of that tick, but there is no person-to-person transmission. Okay, so let's talk about the non-living reservoirs. So this includes air, soil, dust, contaminated water, and food. So again, contaminated in water and foods, we call them vehicle. While fomites are inanimated objects capable of transmitting pathogens, such as beddings, towels, eating and drinking utensils, hospital equipment, telephones, and even computer keyboards, or when you borrow cell phone from another person. So those are considered as fomites. Any inanimated object that can be contaminated and could potentially transmit pathogens, we call them fomites. Even a doorknob, fomites. Okay, so in these examples, we have a drinking cup, eating utensils, blood transfusion apparatus, wound dressing, even this particular micropore tape, syringes, needles and solutions, surgical instrument, bedding, stethoscope, they're all considered as fomites. So I'm just wondering why someone would be wearing stethoscopes and parading himself in the mall with that stethoscope, diba? So that person is actually displaying a fomite. Okay? So the most common mode of transmission of infectious disease. So these are some of the most common modes of transmission. So one of them is through direct skin-to-skin contact. Okay, so you can get, for example, a fungal infection through that. You can get warts through direct skin-to-skin contact. And then direct mucus membrane to mucous membrane contact by kissing. So you can get infectious mononucleosis through kissing. Do you know that infectious mononucleosis is known as the kissing disease? And this one is caused by an Epstein-Barr virus. Sexual intercourse, you can get HIV, you can get syphilis, you can get gonorrhea, you can get human papilloma virus. Okay. Indirect contact via airborne droplets of respiratory secretions, usually by sneezing or coughing. So our example here is COVID-19. Indirect contact via food and water, contaminated by fecal matter. So our example here, typhoid fever, cholera, diba? Dysentery. Indirect contact via arthropod vectors, such as malaria, dengue hemorrhagic fever. Indirect contact via fomites. It could be any hospital, healthcare facilities acquired infections. Indirect contact via transfusion of contaminated blood or blood products or by parenteral injection using non-sterile syringes and needles. These are the reasons why we are screening blood donors for HIV, Hepa B and Hepa C, syphilis, malaria, okay? Because we do not want to get them through blood transfusion. Okay? So, this particular picture will tell us the different kinds of mode of diseases transmission. By the way, there are actually two types of mode of disease transmission. So the first one is called vertical, and the other one is horizontal. So when you say vertical, it is from mother to fetus. So mother to fetus, so which means it's congenital by nature. All of these are considered as the horizontal transmission. Mother to fetus is the only one that is considered as the vertical transmission. Now, according to World Health Organization, this was actually a specialized agency of United Nations, okay, that was founded back in 1948. So the missions of the World Health Organization, or WHO, is to promote technical cooperation for health among nations, including the Philippines, to carry out programs to control and eradicate diseases, and to improve the quality of human life. So they have been involved in various endeavors, including they have been involved in investigation of outbreaks of Ebola virus, and they were successful in eradicating smallpox. And right now, they are attempting to eradicate polio and racunculiasis. So it's kind of parasitic infection known caused by Dracunculus medinensis. Okay, so that is the World Health Organization. In United States, they have CDC. But here in the Philippines, we have the DOH NEC, National Epidemiology Center. But let us discuss CDC. So it's a federal agency administered by US Department of Health and Human Services. So this one is located in Atlanta, Georgia. So it was established 2 years ahead of WHO. So the mission is to collaborate to create the expertise, information, and tools that people and communities need to protect their health. So certain infectious diseases are classified as nationally notifiable disease. So if a certain disease is considered to be as the NNT, each hospital in the United States are required to report it to the CDC. So on a weekly basis, they are publishing the MMWR. So that's the morbidity and mortality weekly report of a certain infectious diseases. So that is the CDC, the Centers for Disease Control and Prevention. So public health agencies should have measures for prevention and control of epidemics. So increase host resistance through the development and administration of vaccines that induce active immunity and maintain it in susceptible persons. So according to studies, so after you have received the first dose and second dose of for COVID-19, you need to receive the first booster, and now the OH is even recommending the second booster shot. So this ensures that persons exposed to a pathogen are protected against the disease. So we have to segregate, isolate, and treat those who have contracted a contagious infection to prevent the spread of pathogens to others. So that's why during the COVID-19 pandemic, even now, we have these isolation areas. So each LGU is expected to have an isolation areas. So these public health agencies are supposed to identify and control potential reservoirs and vectors of infectious diseases. Not included in the functions of these public health agencies is to have graft and corruption, to steal the PhilHealth funds, that's not part of their duty, or to give overpriced, to award overpriced PPEs to family. That is not the functions of these public health agencies. But unfortunately, amidst the pandemic, these things are happening in our country. So sad, no? So microbes purposely used to harm others in wartime are called biological warfare agents. This is another sad scenario. So instead of using bombs, instead of using chemicals, some countries are using pathogens to create fear, chaos, illness, and death in situations other than war. So we call it bioterrorism. So do you know, after the 9/11 attack, after the 9/11 attack, um, bioterrorists have been sending Bacillus anthracis, okay, the anthrax spores, via mail. And these are in powdered form. So when you open the envelope that contains the spores, powder will puff out, and then you'll be inhaling the powder. Unknowingly, this powder would already contain the Bacillus anthracis spores. And that can cause the death of a person who inhaled the spores. Okay, Clostridium botulinum, this is the most potent toxin in the world, more potent than a cobra venom. And that this can also be used for bioterrorism. Smallpox virus. We have already eradicated smallpox in the 70s. But rumor has it that a certain country, Russia, is still actually harboring a smallpox virus. So prayerfully, that's not real news. Yersinia pestis, the cause of Black Death in the medieval period, can also be utilized as a biological warfare agent. So The most commonly used weapon by bioterrorists is the anthrax spores. And you know that there are three types or three forms of anthrax. The pulmonary form, which is transmitted through via inhalation, is one of the deadliest. So pulmonary anthrax is otherwise known as the wool sorter's disease because historically you can get it by sorting the wool of the sheep because that may contain the spores of Bacillus anthracis. But unfortunately, bioterrorists is using it as a weapon. Okay, gastrointestinal anthrax is when you ingest the spores, and cutaneous anthrax is when the spores came into contact, okay, with your skin. So animal products contaminated with Bacillus anthracis, such as hides, wools, and hair, okay, or when you were bitten by the biting insects, okay, so that can actually goes to your skin, that can actually go to your skin, not go to your skin, and then there would be a black ulceration known as a scar formation. Okay, so this is the scar, the black lesion. So this is a smallpox, the disease that was eradicated in the 1970s. Ironically, the pox lesion is that small. And the plague. During the medieval period, there was this plague, bubonic plague, caused by Yersinia pestis. And there are actually three forms of plague. Bubonic plague is characterized by swollen lymph node. And then the pneumonic plague is when you inhale the bacteria. And person-to-person transmission is even possible. So this this is the reason why plague is called Black Death, because of the characteristic blackening of the skin. Okay, water supplies and sewage disposal. This one is very important. Okay, water is the most essential resource necessary for the survival of humanity. So having a polluted water is not really a good scenario of the ideal public health. Okay, so water can be contaminated via chemical pollution and biological pollution. So when you say biological pollution, it means that the water is no longer potable because of fecal material. And do you know that the most common indicator of fecal contamination of water is Escherichia coli? If water is tinged with Escherichia coli, it means that the water is fecally contaminated. So water is fecally contaminated. So in 1993, there was this cryptosporidiosis epidemic in Milwaukee in Wisconsin. And this was one of the largest waterborne epidemic in the history of the United States. So cryptosporidiosis is caused by a protozoan known as Cryptosporidium parvum. So if you ingest the infective stage of Cryptosporidium parvum, you will get signs and symptoms related to cryptosporidiosis, and one of them is, of course, diarrhea, which can lead to dehydration, and if not dealt immediately, this could actually be fatal. Okay, water supplies and sewage and could be contaminated by improper disposal of sewage, by outhouses, and even by animal feces. Okay, so that's the reason why, for example, an outhouse can contaminated a water well, or sewage disposal plant can contaminated stream water. That's the reason why many of the factories are required to treat water before they are being disposed in the stream, for example. So water treatment is considered to be as the major step, okay, the major step in order to achieve potability of water. When you say the water is potable, it means that it is actually safe for consumption, safe for drinking. And then there are several steps. So this includes sedimentation, so that you want those unwanted solid particles to go at the bottom, coagulation, filtration, and lastly, chlorination. So water is tested for fecal contamination by checking for the presence of coliform bacteria. So as what I've said a while ago, Escherichia coli is considered to be as the best index of fecal contamination of water. Having said that, it is if we do not only treat water, we also treat sewage. So raw sewage consists of mainly water, fecal material, garbage, and bacteria. Okay? So there are many facilities available for the treatment of sewage. So this includes the primary, secondary, and tertiary sewage treatments. Okay, so again, water is treated via sedimentation, and then it is being coagulated, filtered, and lastly chlorinated, so that the one that goes to your faucet is considered already as a clean, pure water. But unfortunately, if you are a subscriber of Maynilad, this is actually far from reality. So I'm not sure, but I bet that none of you is actually drinking water from the faucet, no? So we usually order water from a water station because these are already treated water. It's very rare that people would be directly drinking um, water from the faucet. Okay, so that ends our discussion for today. So again, thank you very much for listening.